Hey guys, it's Max Livingston here. I just wanted to talk to you about how my recovery with primal physical therapy helped me. In my most recent Fury match, probably about 4 to 5 weeks ago, I was trying to defend a Darce, and during one of my rotation, I may have popped a rib or cartilage in my rib. Any sort of trying to training or quick twitch movement, there was a sharp pain, felt like a stab in my rib. I took that to Dr. Eric and JJ at Primal Physical Therapy. Immediately they were able to get me in. They asked about my injury, how it happened. From there, we got to do some laser treatment and some dry needling. Before all of that, I had some bruising and some swelling. The red light therapy immediately took some of the swelling and the bruising away. And then as I continued to feel some pain throughout the weeks, we continued to do dry needling, and every single session I felt more flexibility in my rib, less pain, no sharp pain. The more I went and continued to talk to them, they gave me exercises to do in between, and I'm back to full strength. I'll be heading over to the UK to compete, and I feel 100% as of now. So it's great. The hospitality there was fantastic. I couldn't thank them enough. So any sort of injuries that you guys have, make sure you get yourself over there. They're the real deal. It is real. It's really good stuff. Thank you, JJ. Thank you, Eric.
Welcome to the Dr. JJ Thomas Podcast.
Hey everybody, I'm Dr. JJ Thomas. Welcome to the Dr. JJ Thomas Podcast. This podcast, we're doing a clinical round. And in the clinical rounds, what we do is we go through real life scenarios of patients of mine, and we talk about the thought process in both the evaluation and the integration of treatment all the way to return to activity levels. So this is, I'm always, I can't help it. I'm always picking my favorite patients and the ones that I think are really cool and also have a lot of applicability to many different patient scenarios that you guys might see. So this scenario today is from my friend Max, who's a Brazilian Jiu-Jitsu athlete. He's a former wrestler as well, and just an awesome all-round competitor and person. He texted me one day after a competition, and it was just in January. It's February now. It was earliest January. He said, JJ, what he was doing, he said, I popped my rib. I'm in a lot of pain. There was no bruising. And I didn't really feel like it was too swollen. He did say there was a little bit of swelling, but he said, but I felt it pop in my pec area. It was on the left side. It's really bothering me. It's really limiting me now. I can't compete. I'm not able to do the things I want to do. Can we take a look at it? So he was traveling. By the time we got to look at it, it was a couple weeks later, but it was still really limiting his function. So when I looked at him, let me back up. The mechanism of injury was, he said he was doing a roll. He was doing like a rolling twist to defend a Darce. So a Darce is a type of choke. If you don't do jiu-jitsu, a Darce is a type of choke. And so he was trying to roll out of it, and I believe his hands were clasped, which is why his pec muscle got tweaked on this. So on palpation, we confirmed that one of his pec major muscle striations was tweaked right on the rib attachment near the sternal attachment. So I'm going to show you on the screen here, and so here we have. I'm going to zoom out a little bit. Here's the pec major muscle. Remember how it attaches. This image doesn't give it enough. It has finger-like attachments onto the ribs as well and onto the sternum. I'm actually going to remove the external oblique here so you can kind of appreciate a little bit better. Let's also remove rectus abdominis. So you can see these pectoral attachments kind of coming onto the sternum and onto the ribs. What happened with Max is his pec attachment onto the rib, I believe the pop he felt was a little bit of some of those fibers on one of his rib attachments. Now, by the time I got to him, it was almost 2 weeks later. So the actual healing process had already it had been 2 weeks. So it had already gone through some proliferation and healing in and of itself, but he was still really tender on that. The way we treated it, there was no swelling, like I said, just tenderness. We did our class 4 laser, which is great for facilitating healing. We did that a couple times. We did soft tissue work, and actually I used the Windback machine here as well, which is high frequency electrocurrent. But it's a lot of modalities to loosen the soft tissue musculature in the entire pec region and the abdominal region. So remember, I removed in this here, I removed the abdominals, but if you notice, they're attached, you can see on this side, the abdominals attach right up, they have an aponeurosis right up with the pec major. So whenever I have someone with a pec injury, I 100% will treat their abdominal muscles just to take the stress off that pec attachment. Same thing is true from anterior delt. Like all of these muscles we want to treat to take pressure off the site that was actually pulled or injured. So we did a lot of soft tissue to the abdominals, the pec itself, the anterior delt, and then I sent him with some early exercises, which I'm going to show you in a little bit. I want to just give one more treatment intervention suggestion, and that's by the second time I saw him, his healing, it was at least 3 weeks, maybe even 4 weeks post-injury. He was progressing much better. But that was the time where I said, you know what, Max, let's treat this a little bit more aggressively. He has a competition coming up. I want to make sure he's ready. And we dry needled the proximal pec, again, to take, on this side, to take the stress off that rib attachment here. So I grabbed the pec major, I needled the muscle belly proximal to the injury itself. That improved his symptoms dramatically. So retest of pec activation, he was able to do much more. He reported to me that next day that he went to train that night and was able to do a lot more in training, very active. He's like getting back to 100% now that we did that last little bit of muscle work with dry needling to the proximal portion of the pec. We're going to switch over to exercise now. I'm going to show you the exercise progressions we did with Max to help him get back to training faster and get him ready for his competition. To get Max back as soon as possible to competing and training, we want to get that pec muscle firing and loaded in a safe way. As we know as clinicians, one of the best ways we can load a muscle is isometrically. So it's very safe after a muscle pull to isometrically get those fibers contracting and firing to stabilize, which will support healing, bring blood flow to the area, get the nervous system engaged, and really support the healing process. So the way I like to give isometric pec activation for post-pec strain or even pulling on the periosteum like Max's was, is really just by taking a good sized ball and having them activate here. So I had him just do regular isometric presses that first couple weeks. So just squeezing and pressing, squeezing and pressing. When he tells me that's okay, then the next phase of that is squeezing, holding, and now changing elongation by having a slight push out and then control back, but I'm having him compress that ball the whole time. So compressing, getting that pec activation, especially at the sternal region there, and then holding that compression as he comes out and back. After weeks of that and him feeling better and starting to integrate back into rolling, we bring it to explosion. So now we take that ball and we get close to the wall and we press, 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 like that. And then we can speed it up, so explode and fast. I'm gonna go closer for it. Fast, 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 like that, right? And then we wanna get rotation. So we can have it here, and we're still gonna get pecs, right? And we're gonna rotate, catch. Rotate, catch, rotate, catch, rotate, catch, rotate, catch, or don't catch. So that's it. So the progression is really safe isometric, static, not static, but not dynamic, and then isometric with dynamic, and then isometric initiation with some explosion, but paced explosion, and then speed up explosion, and then add rotation. Now, all the while, he's training within his comfort level. Like, when we got him back to training, my advice to him was like, look, roll with, roll meaning in Brazilian Jiu-Jitsu, if you don't do it, rolling is training, essentially. So I said to Max, train with partners that you're comfortable with, train with partners that you can do positional guidance with, so that he's not just all out putting himself in compromised positions. And that's how you return to sport in that environment. So this worked great. Max is doing great. He's about to compete very soon, actually out in London. So I'm super pumped to watch him and see his success. Talk soon.